which is great. If we could please keep it that way, then it will avoid any of your videos showing up in the recording. And finally, there is a chat box. So if you have any questions, please feel free to type your questions into the chat box during the presentation. And then at the end, we'll have plenty of time to go through all of those. And if you're calling in from a phone, then you can feel free to unmute yourself at the end during that question period to ask questions as well. Great. So the agenda for today's call is, first of all, we will just be giving a brief overview of the Options Initiative, and then we'll be walking you through the application process. And finally, we'll be going over some strategies for developing a strong proposal and some tips and tricks for that process. We'll start with the overview of the Options Initiative. This here is the challenge statement that summarizes what the Options Initiative is. So the goal of the Options for Pregnancy Termination Innovation Initiative, or the Options Initiative for short, is to support bold ideas with big impact for women's and girls' access to safe abortion in low and middle income countries. We are seeking innovative and transformative approaches that put women and girls in control of where, when, and how they terminate their pregnancy. Within the Options Initiative, we have two separate areas of focus. The first that you can see here are new approaches to increasing early access to existing abortion products and services. And the second is developing and testing next generation methods of pregnancy termination. We'll take a bit of a deeper look at each of those here. And if you have reviewed the request for proposals already, you'll be familiar with this because this is all pulled exactly from that request for proposals. So you can also find all of this information in there. But diving into the increasing access to existing methods of safe abortion, the list you see here is not exhaustive, but it provides some ideas of the types of innovations that could fall into that category. So as you can see, these could be ideas that focus on increasing the number of trained providers and available safe services, innovations that improve access to information that will help a woman or girl safely terminate a pregnancy, combating stigma by reframing and normalizing abortion, decentralizing and demedicalizing abortion care, reducing the economic barriers to accessing safe abortion, and finally, reclassifying existing abortion methods to fit within existing relevant regulatory frameworks. The second area of focus is looking at introducing a next generation method of safe abortion that provides one or more improvements over existing methods. So once again, this list here is not exhaustive, but it's a few ideas for things that we would look for in a next generation method of safe abortion. One of these would be a next generation method that is able to be effectively administered at later stages in gestation. The ability for women and girls to access and self-administer with greater autonomy and privacy would also be something we would look for in this next generation method. An improved ease of compliance. So for example, a single pill or fewer pill administration compared to the current medical abortion protocol. Reduced side effects and pain, an improved stability profile, improved ability to be permissive within existing regulatory frameworks. So for example, looking at drugs that have other primary indications and are already available within more restrictive settings, for example, and a method that is also cost effective. It's important to note that this here is the sort of target product profile for next generation methods, but both preclinical and clinical stage proposals are eligible, and the project objectives for this 18 to 24 month grant period would be tailored accordingly. So we're open to ideas at any stage, and we do expect that many of these would be quite early stage. These are all proof of concept awards. And so we're looking at testing a new idea. And within the 18 to 24 month period, what we are expecting to see are changes in at least one of the following outcomes. It could be improved access to existing methods of safe abortion, which aligns with the first area of focus we spoke about, reduced delays in a woman's decision to seek care, reach a facility, or receive care. And finally, more aligned with the next generation method side of things, scientific evidence that a new drug, formulation, or prototype for pregnancy termination has significant improvements over existing methods. This summarizes more of the parameters of the actual grants. So again, these are all seed grants. So they are 250,000 Canadian dollars for a period of a year and a half to 2 years. And assuming we receive a sufficient number of high quality proposals, we're aiming to award about 20 grants this round. The target beneficiaries for these awards are women and girls in low and middle income countries, with the caveat to that being that, of course, the next generation method may benefit women worldwide. Geographically, the restrictions vary across the areas of focus. In the first area of focus, improving access to existing methods, the innovations must actually be implemented within a lower middle income country within the 18 to 24 month grant period. So for example, we wouldn't fund research being done in a high income country that wasn't actually implementing the idea in a low and middle income country during the grant period for that area of focus. For the next generation methods, however, again, we expect that these may be very early stage. So it's fine for these to be being developed and tested in any country, including high income countries at this stage, so long as they're designed with the ultimate target beneficiaries in mind. Here, the next two slides, we'll get a bit more into the eligibility criteria. And again, this is all pulled directly from the request for proposals, so you may be familiar with this already. But essentially, we are able to fund any recognized institution. So that could be a nonprofit, an academic institution, a for-profit, any legally incorporated institution that is not an individual person. So a legally incorporated entity. This first point here is new to the RFP if you are familiar with the round 1 RFP. So this is a change that we have implemented for round 2. And as you can see here, it says that we cannot fund institutions that are not previous or current direct grantees of the Very Large Anonymous Donor. Sorry, just to clarify, we cannot fund previous or current direct grantees of the Very Large Anonymous Donor. If this doesn't make sense to you, you're not sure what we're referring to, then it's most likely not applicable to you. If you're unsure, you are welcome to send us a list of your direct funding sources, and we can confirm or deny for you if the Very Large Anonymous Donor is amongst them. If you have been previously funded by the Large Anonymous Donor, then you will not be eligible for Options Initiative funding. Looking at geographic restrictions again, so for the access category, improving access to existing methods of abortion, this area of focus is only open to institutions that are legally incorporated in a lower middle income country themselves. Again, this is a change from round 1 if you were familiar with our RFP from last year. So only low and middle income country institutions are eligible to apply to that first area of focus. It's different for the next generation methods area of focus. Institutions worldwide, including high income countries, are eligible to apply to the next generation methods category. So essentially, if you are a high income country institution, that second area of focus, the next generation methods, is the only category that you would be eligible to apply to. If you're from a lower middle income country institution, you can apply to either. The rest of these points are fairly self-explanatory. The institution has to be capable of receiving and administering grant funding. And the last point here is worth mentioning. We are not able to fund United Nations country offices. We found in the past that UN country offices are often unable to agree to our grant terms, so UN country offices are not eligible to apply. Carrying on with the eligibility criteria, a project can only have one project lead who must be directly affiliated with the institution from which the proposal is being submitted. And that project lead may only submit one application. Each institution may only submit one proposal per area of focus of the RFP. So an institution could submit one application for increasing access and another application for next generation methods, assuming that the above criteria are met. And this is a bit different for universities since they are such large institutions. So one proposal per focus area of the RFP will be accepted from each research center within a university. And finally, any project leads funded under options round 1 are ineligible to be funded again. However, institutions funded under round 1 are still eligible to apply if all of the above new criteria are met and there's a different project lead. Options is focused on supporting innovations that improve access to safe abortion in countries where there are one or more legal grounds to support it. Although we recognize prohibitive laws and policies as one of the key determinants to the uptake of safe abortion services, legal reform is not an objective of this call. We would not fund an application that was purely focused on sort of advocacy and lobbying. That would not be in scope of this call. However, an innovation that aims to increase awareness and understanding of local laws to ensure women know their rights, for example, in a country where it's largely unknown that there are legal grounds for safe abortion, that would be in scope and it would fall under the improving knowledge and awareness category of the increasing access area. To give a sense of a few things that would not be in scope that we would not fund along with the advocacy projects that I just mentioned, we do not fund initiatives that are purely focused on capacity building. We do not provide ongoing programmatic funding. So again, these funds are intended to test new ideas, to test proof of concept by the end of a 2-year period. So we do not provide funding for just sort of ongoing programs that aren't testing a new idea. And of course, ideas that are not applicable to the target beneficiaries or do not align with the scope of the RFP. We also receive a lot of questions about innovations that are complementary to existing abortion methods, and if those would be considered a next generation method of abortion. If you have a question like this and you're unsure, please feel free to reach out to us and we can address it on a case-by-case basis. But essentially the takeaway is that innovations that are complementary to existing abortion methods but still rely on existing methods cannot be considered a next generation method. So for example, a new type of pregnancy test that may have impacts on safe abortion is a very worthwhile idea. However, since it still relies on one of the two existing methods of abortion, MVA or medical abortion, it would not be considered a next generation method. The next generation method must be an entirely distinct from the existing MVA or medical abortion. And finally, innovations that are too similar to innovations previously funded by Grand Challenges Canada or by the Options Initiative would not be funded. The best place to look for this is on the Options Initiative website. You can see some of the innovators that we have funded under round 1. They're very brief project summaries, so I'd encourage you to just take a skim of those to make sure that there are no ideas that are too similar to the idea you're planning to submit. A few things that we are looking for this round. One idea that we really want to emphasize is that we're welcoming new entrants to the safe abortion space. So innovators that bring a fresh perspective to the space, have novel ways of addressing this problem, will be viewed favorably in the review process. Um, so this means innovators across all disciplines are encouraged to apply, even if they haven't specifically worked on something directly aligned with safe abortion in the past. If they have a new idea and they would be interested in moving into the safe abortion space, we really, really welcome those type of applicants. We also have an elevated priority on next generation methods. We noticed in our first round that this was a much smaller proportion of the applications that we received, and we'd love to see that increase. So if you or anybody that you are connected with has an idea for a next generation method, we would strongly encourage you to apply. And finally, just want to really emphasize that these are seed grants. So all ideas at any stage are welcome, including very early stage. These are blue sky ideas to really test a new idea. So no idea is sort of too big or too small at this stage. We'll move on now to an overview of the application process. And again, all of this information can be found in the RFP. So you can find all these details there, but hopefully some of these images will help walk you through how our portal works. You must apply through the Flux portal, which is our application portal. We cannot accept applications via email. We can only accept applications that come through this portal. So if you go to gcc.flux.io, you will see this screen that you can see here. If you have already applied for any Grand Challenges Canada program in the past, you should already have an account, and you can enter your username and password here on the left. If you forget your password, there is a link just below here that says reset or create password, where you'll get an email prompt to change your password. If you have never applied to Grand Challenges Canada before, then you'll need to create an account, which you can do at this button here on the right. And you'll just need to put in your basic information and give us about 1 business day to process that, and then you should receive an email with your login credentials. If you do not receive that email within a day or two, please reach out to us because there's a chance it may have just gone to your junk box. Once you log in and you go to the Welcome tab, which you can see here on the left-hand menu, you will see this page that includes an announcement about the options RFP being open. And if you scroll down, you will see this button here that says Start Your Options Application. Once you click on that, you will have the application open, and you do not have to do it all in one sitting. So you can save it at any time. You can see here in the bottom right of the screen, there's a save button. And then you can come back to this drafts menu here, where you will find your partially completed application, and you can continue to work on it. When you open up your draft, you'll have to click this edit button in the top right-hand corner of the screen, and then you'll be able to continue working on it. Once you have completed your application, please hit save and then click this submit button. If it's just saved and not submitted, we will not receive it. So please ensure you click the submit button, and please ensure that it is finalized when you do so, because then you will no longer be able to edit it. We're just going to highlight a few of the frequently asked questions that we receive. Please note that we do have a much longer FAQs document on our website. It has about 40 questions on it. So if you have any questions, please consult that. But these are a few that we receive frequently, so just wanted to highlight these. First of all, if my innovation is not targeting the beneficiaries mentioned in the RFP, can I receive funding? The short answer to this is no. Proposals which do not address women and girls in eligible low and middle income countries will not be considered for funding. However, the caveat to this again is that next generation methods of abortion could potentially benefit women worldwide, and they can be developed and tested in any country, including high-income countries, at this stage. How do I know which countries are eligible to apply? Again, for the next generation methods, it could be any country. For the improving access category, you can consult there's a list at the very end of the RFP in one of the appendices, there's a list of the World Bank classified low and middle income countries. How would I know if I've received funding from the Very Large Anonymous Donor? Again, if you have no idea what this means, then it's very unlikely that you have received funding from the Very Large Anonymous Donor. If you have any uncertainty, then you are more than welcome to reach out to us, send us a list of your funders, and we can confirm if they are on there. Again, is it possible to submit a proposal focused on advocacy or policy and legal reform? Again, no, while we recognize that prohibitive laws and policies are a key determinant of the uptake to safe abortion services, policy and legal reform are not objectives at this call. And finally, do I require co-funding? No, co-funding is not a requirement at the proof of concept stage. Some of you may be familiar with Grand Challenge's Transition to Scale program, through which we do require match funding. However, for seed grants, such as the options grants, no co-funding is required. And the link here goes to the rest of the FAQ document, so feel free to give that a read. And if you have any questions that aren't addressed on there, you can reach out to us by email. Go now into the proposal development section of the webinar. So we're going to walk through each of the sections of the application, not through each individual question, but through sort of the overarching themes and a few tips to help you with writing those. The first section is the project summary. And the project summary is made up of the 4 questions that you see here. What is the problem addressed by your innovation? What is your proposed innovation? What are the current approaches to the problem? And how will your innovation address it more effectively? And finally, how is your innovation relevant to vulnerable and marginalized women and girls in low and middle income countries? These first 4 questions are very, very important because they are all that is reviewed at the first screen of the applications. So if you're interested to learn more about the review process, it's described in detail in the RFP. But basically what happens is first, all of the applications go through a basic eligibility screen to remove any applicants that don't meet the eligibility requirements. Secondly, we do an innovation screen where 3 different reviewers will review just this project summary, just these first 4 questions. And they will review it for the level of innovation and the level of relevance to the call. In round 1, about 70% of the applications didn't make it past this initial innovation screen. So that's why these first 4 questions are very, very important. So a few tips on how to write these well. First of all, make sure that you are defining a very specific problem to the context of the proposed innovation. What we see a lot is that applicants write, the problem is that there are 25 million unsafe abortions that happen worldwide every year, the vast majority of which are in low and middle income countries. That certainly is the broader problem that we are trying to address with the Options Initiative. However, it's less helpful for your specific innovation. So really try to define the problem in the area that you are planning to work. Clearly articulate the proposed idea. So we understand that these sections are shorter. However, again, those longer sections that come later in the proposal will only be reviewed if you make it to the external peer review stage. So it's very important to have all of the key information in this project summary instead of referencing later sections that the first reviewers won't actually be reading. Also, it's important to explain why your proposed idea is novel and why it will be an improvement over current approaches. So really upfront addressing what are the current approaches to addressing this and why is this better? And of course, clearly demonstrating the relevance to either focus area 1 or 2 of the RFP. For the project summary, you go into the longer sections of the application. The first is focused on boldness, creativity, and integrated innovation. So once again, these 2 questions you see at the top here are not the full application questions. You'll have to log into the Flex portal to see all of the application questions, but these give you a sense of the general ideas that are trying to be pulled out in this section. What's important here is to really, really clearly explain what makes the idea innovative, different, bold, and creative. In terms of integrated innovation, this is an idea that we have at Grant Challenges Canada that we look for in all of the innovations that we fund across all of our portfolios. And the idea is that innovations should integrate elements of scientific or technological, social, and business innovation. Now, we understand that depending on the innovation, these will be differently weighted. Some innovations may be very, very heavy on the scientific or technological innovation side of things, and less so on the other two. Some may be very focused on social innovation and less so on the other two, and so forth. But it's important to demonstrate that you have thought through each of these three pillars. And at the external peer review stage, there will be reviewers from each of these different pillars reviewing your application. So it's important that each of those are called out. The next section is focused on the project execution plan and technical merit. What's important here is to really give a clear description of what it is that you will be doing. What we have heard many times from reviewers is that they feel like they get the sort of general idea of the application, but they don't have a clear sense of what the actual sort of timeline of key milestones will be, what the actual plan is to achieve proof of concept. So the way the questions are laid out is first you will define what the proof of concept is that you are trying to establish within the time frame of the grant. And another way to think about this question is, how will you know if your innovation has been successful or not at the end of the grant? So what is the new idea that you are testing? And what is the threshold that has to be hit to know that that idea is successful and that it works? That's the proof of concept that you're trying to establish. And then the second question, what is the project execution plan to demonstrate this proof of concept within the 18 to 24 months? This is where it's important to really lay out your sort of timeline of activities, what work you will actually be undertaking, and to give a clear description of the indicators that will be used to measure success. Another note on proof of concept, since we receive a lot of questions on this, and again, you can find this in the RFP, but success for seed grants is defined as one of these three things. Evidence from a controlled or limited setting that the innovation improves access to safe abortion or reduces significant barriers to accessing safe abortion. Evidence that the innovation can be feasibly implemented, sustained, and financially supported in the target regions. And demonstrated interest, financing, or commitments for uptake of the innovation from key stakeholders and partners. Now, some of these will come later in the award. We understand that if this is a very new idea, you may not have demonstrated interest or commitment from key stakeholders at this point. What we would look for is that you've started to think about who those partners might be, and you have a plan in place to sort of start those connections throughout the proof of concept award, so that if you do achieve proof of concept and your innovation is successful and you are a good candidate to transition to scale, you have some of these things already in place. The next section looks at your expected health results. In this section, you'll be asked to indicate your expected results over, first of all, the timeline of your grant, 18 to 24 months, and second of all, over 3 to 5 years, so beyond the grant period. What's important to do here is to provide actual estimates of the number of women and girls that you expect to reach within both of these time periods. So what can strengthen your proposal here is, instead of saying, we're going to reach every woman of reproductive age in this country, actually giving some more thought to what are the numbers, what is the actual population of women and girls of reproductive age in this, for example, county of this country, and what percentage of those do you think is reasonable to reach? We understand that for seed grants, these numbers might be low. We're not expecting you with a proof of concept award to be reaching hundreds of thousands of people. We're just looking to see that you've put some thought into what a realistic number of women and girls would be that you could reach within this 2-year period while you're testing your innovation. And then again, looking at the quantitative benchmarks or threshold that you would use to measure success. So compared to whatever the baseline is, what would the increase in access be? For example, for the first area of focus, or for the second area of focus, what percentage of efficacy or acceptability would qualify success for a next generation method? The next section looks at scale and sustainability. And the overarching question is, does the proposed idea have a path to and potential for impact at scale? Once again, this is something that we know would become much more in depth at the transition to scale level, but it's something that's important to see you are thinking about at this proof of concept stage and thinking, if this idea I'm testing is successful, then what? How would I move this forward? How would it be sustainable and be able to scale post this options seed award? So how you can write a strong application here is really describing your envisioned path to scale. Is it through a private scaling pathway or public partnerships, for example? Describing the involvement of the partners and stakeholders who could help with the scale of the innovation and how you would plan to engage them. Potential plans for leveraging or generating other sources of funding, and potential for the innovation to be replicated in other regions or countries. Is this an idea that if it proves successful in the context where you are testing it, where else could it potentially be impactful and be applicable? And the next section is on the project lead and team. So what's important to do here is give some background information on the institution, the longevity, amount of overall funding, the sort of track record of the institution, just to give some context to the reviewers who may or may not be familiar with your institution. That said, if you are a very, very new entity, please don't let these questions deter you. Once again, we are open to very new entrants to the space. We're open to ideas at any stages and to institutions across sort of a wide range of stages, whether they're very new startups or more established institutions, such as universities. But it's just helpful to have a sense of what the institution is when we're reviewing it. There's also a section where you can include information on collaborators. It's important here, a lot of people just list who the collaborators would be. It's very helpful if you also indicate what exactly their role would be. And finally, if you can explain why your institution adds value to the safe abortion space and how it brings new perspectives, how it's positioned to introduce novel ways of solving this problem, that will help you as well, as we do, once again, have a focus on sort of bringing these new entrants into the space. So I'll leave you with a few key dates here. The application deadline is February 11th at 3 p.m. Eastern Time. So that's the most important one on this slide. Above that, you'll see a suggested deadline to register for Flex as February 4th. This is because it takes a day or two for your registration to be processed before you can access the application. So we would actually encourage you to register much earlier than that, but certainly no later than February 4th, seeing as the deadline is February 11th to submit an application. Once all the applications have been submitted, we will go through a review process, and you should be notified of your application status by the end of June 2020. And the successful applications will then go through a grant negotiations period, which typically takes about 3 months. So we anticipate that these projects would actually be starting by the end of September 2020. And we'll leave you with this slide, which again just reiterates the deadline of February 11th. It also has our email address here, where you can feel free to reach out at any point if you have any questions. And finally, if you know of others working in this space who may not be aware of this funding opportunity, we would be really appreciative if you could please highlight this to them, circulate this to your networks. that would be super wonderful. If we can help provide any materials for that, again, please feel free to reach out to this email and we can send you a quick blurb on options and an image that you can feel free to circulate. So thank you very much for your attention. I will be going to the questions now. So if you have any questions, please feel free to type them in the chat and we will start going through those one by one. Great, so it doesn't seem we have any questions so far. If anybody does have questions, please feel free to type them in the chat. We'll stay on for another couple of minutes. As well, those who are on the phone who do not have the chat box, if you have questions, please feel free to unmute yourself now and ask any questions that you have.